but how do we bring and elevate other voices that maybe don't feel like they have that same access?
You have the opportunity to make big impact in small communities. But as soon as you get to the big city, your impact is really watered down.
The difficult thing about prevention, you don't see when someone doesn't start smoking. You don't see when someone doesn't develop an addiction.
And honestly, what I found was like, look in your own backyard.
Yeah. How do we make sure that there is continued trust between our partnerships?
Change happens at the speed of trust.
How do you find the small wins in things?
Burnout is real. And we found overwhelmingly as many downtown business owners, even bar owners, were supportive.
It was the stories. It was the anecdotal evidence from the youth.
Is there enough awareness on this topic in the community about how big of a problem is with our kids and like what age we're starting to see our youth use substances earlier and earlier?
That is not prevention. That's treatment.
It would have been so easy to be like, oh, well, we don't have the funding. Like, our organization can't do it. Sorry. But you're like, no, we're going to do this thing and we're going to build the capacity. We're going to make it happen. And you have. So this is episode 4, Partners in Prevention. And today, what are we talking about?
We're talking about step 2 of our strategic prevention framework, capacity.
And I'm really excited about this because I think we've done a pretty good job as a community within Douglas County.
We have, but we have some key players that are keeping that going. Really excited to bring a guest today to talk about all that she's doing in our community with her organization and supporting well-being in Douglas County.
Yeah, and I think this guest has more experience than either of us combined.
I definitely agree with that. I definitely think that's true.
Well, I'd love to introduce her. Her name is Jessica Hand.
Thanks for having me. It's nice to be here. What an honor. I've been a fan of this podcast for the last couple episodes, checking out your previous guests. So very neat to be here and talk about Thrive Umpqua and our work together in the community with the both of you.
Yeah, that's really exciting. I think just to start, do you want to share a little bit about yourself and Thrive Umpqua and maybe what got you into this work?
Yeah, absolutely. So I serve as the executive director for Thrive Umpqua. It is Douglas County's well-being initiative that started as Blue Zones Project back in 2017. And really the mission is pretty simple, although it's hard work, which is just making our community a healthier, happier place to live and all the places that we spend our time, work sites, schools, neighborhoods. We like to encapsulate our work into the 3 Ps, which, probably resonates with a lot of public health people out there. People, individual programs, places where we spend our time, and the policy, what really makes it stick for the long term in communities. My background is in public health. Recently hit a milestone, which I'm pretty proud of, 20 years working in this field, which is pretty
Congratulations.
amazing.
So we weren't lying.
Yeah.
That was fact.
Yeah, and there's a reason I've stuck around because it is really rewarding work and getting to work with partners like you all and those, probably many that are viewing this as well. Really what makes it pretty special, right? Because it is long-term work that takes generations sometimes to change and move the needle in some of these areas, but you really start to see the impact and the personal stories where we know we're making a difference, right? Yeah, and it comes from having capacity and people dedicated to this work.
For those that have been watching along, or maybe those that haven't, we can give a quick recap of what we've been going through on this podcast, and that's really talking about the science of prevention. Trying to prevent harm from happening in our community before it happens, right? And there's a science to it and a framework that we often use called the Strategic Prevention Framework. It has 5 steps. And last episode, we talked about assessment. How do we identify the problems that we want to address? And this episode, as we mentioned, we're talking about capacity. And so before we can actually address the problems that we identified, we have to figure out what do we already have and what do we need to actually find a solution and address that problem. So that's what today's episode is all about. And to begin, how do you describe capacity? What does that entail? And what does that look like in your work?
Yeah, I mean, it's all the things that make systems go,
Yeah.
right? Right? It's definitely funding and it's definitely staff. I think that's usually what comes to mind when you think of capacity. But I think it's all the other conditions that really make prevention work stick. So it's having trust in who you're serving, trust in organizations that are partnering together. It's having community voice so that there's really authentic representation in your work, that you are meeting the needs of the people you're intending to serve. It's shared leadership. So it's not one organization coming in and saying this is the solution or this is the strategy, but it's really, oh, and we call this, at Thrive Umpqua, we say it's a we project.
Mhm.
It's not Thrive Umpqua coming in and saying this is what we need to do. It's all of us deciding that together and honestly landing on a solution that resonates with all of us. So I think it's really all of those conditions combined that make capacity. And some of those latter ones, like trust and leadership development, shared leadership, I think are some of the most important pieces and sometimes the hardest, right? That we try to look at and really be honest with ourselves. How are we doing in this area?
When you started this, what did capacity look like maybe 20 years ago compared to today?
Yeah, I think when I first started in public health, I honestly thought I'd be working internationally. I saw so much need, in other countries. I think I always had a strong interest of what can I learn from other cultures,
Mhm.
and I want to go help somewhere.
Yep.
And honestly, what I found was like look in your own backyard,
Yeah.
because there is a lot of need here in our own communities.
Mhm.
You don't need to go far to find it, and you don't need to go far to find a lot of strength and amazing people at work every single day. Douglas County has so much going for it, but we also know, wow, there's a lot more work to do here.
Yeah.
Um, I think what I've been really encouraged by is more and more communities like ours that are recognizing we need to invest
Mhm.
in long-term systems and policy change. Like there's
Yeah.
a lot of one and done programs, they come and go with grant cycles, but like we really need to stick to this
Yeah.
and we need to make sure there's sustained funding, there's sustained coalitions and
Mhm.
groups that are going to continue to keep a steady drumbeat on this. And I'm really encouraged by that because I think our community's done that really well for
Mhm.
the at least the last 8 years and beyond. Because I know there's a lot of, um, other amazing efforts here that really led to Blue Zones Project coming here and now Thrive Umpqua working in this area.
Mm.
But we are just kind of building upon the footsteps of everyone else that's worked here for years and years, decades of this.
Yeah.
Yeah.
And what are some of the capacity building like today in today's environment? What does that look like on the ground here in Douglas County? And do you have any examples that you can share, specifically maybe how Thrive Umpqua builds capacity with
Yeah.
partners?
For us, it really started with, just to take a step back and look at kind of the history here in the community over the last 10 years. We had a tragedy at UCC in 2015. And for us, in a way, that's where our story started as Blue Zones Project, because at that time, our leadership here in the community really took a look at what led to this? Like, what were some of the conditions on the ground here in the community that really allowed this tragedy to happen? And what can we do to try our best to prevent something like this happening again? They formed a group called the Chart Community Healing and Resiliency Team, 70 leaders, I think, coming together monthly to talk about cross sectors. What are we going to do differently? And at that time, I think they were looking at a lot of different strategies. It really formalized some powerful, partnerships with people that really had never sat down together before. And one of those strategies was Blue Zones Project. It was in a couple communities in Oregon. It was a national collective impact model for community health that was gaining a lot of steam and recognition. And they're like, hey, we want to apply for this opportunity. We want to bring this here because we feel it'll give us another shot at really preventing, some of the issues that we have here locally. There was strong community leadership to be successful with that application, but there was a lot of need that stood out here in Douglas County that I think really set our application apart. So that really prompted um, a group of leaders continuing to meet even after CHART that became the steering committee for Thrive Umpqua that said we're going to take a really cross-sector lens to look at our issues from all of the different organizations we represent and make sure that this is really a joint effort across the community. It's going to take healthcare, it's going to take education, it's going to take government leaders, it's going to take philanthropy, it's going to take all of us together rallying around this to do something differently for our community. So I think for us, that was really the foundation that helped build a lot of capacity here, knowing that there was leadership behind it. And then the next step really is how do you get the community engaged, right? Like, how do you really get them to a place where they feel like they're a part of it and they're helping to set the course for what is going to make a difference for them in terms of their health? So we do that in a lot of different ways. Community events where people like an event like Longest
Longest
Table,
table,
people
yeah.
just sitting
Mhm.
down with random strangers,
Mhm.
but your neighbors in this community, and just talking about what do you love about living here? What are some opportunities for us when we think about what we'd like to see change in this community? And coming at it from very different perspectives and realizing, hey, it's okay to sit down with others with different viewpoints and really think about how do we design some solutions together,
Yeah.
you know? So that's a couple ways that we go about it that I really think has helped Thrive Umpqua bring in more community voice
Mhm.
and make sure that shared leadership is there.
And that's one thing I don't think I hear very often is like how can we engage the community to be part of these efforts? A lot of it is like let's build programs to like help the community, but
Yeah,
it's not really like that reverse process. Like let's bring community in, let's talk to them.
right,
What's going to work for you? And it
right.
seems like when there's more of an investment from the community, there's more buy-in. These programs are more successful. The community wants these things to live on.
Mhm. Yeah, we say don't do it to them, do it with them,
Yep,
right?
Yeah.
We don't design
exactly.
programs to people. We design with, we co-create. I think something else, and this is really where our work together, comes in day to day, is community-led committees,
Hmm.
right? We
Mhm.
have a tobacco policy committee that's a mix of folks that work in this area day to day and others that are just interested in the topic sometimes. In the
Hmm.
past, we've even had high school students attend when we were looking for their input on certain policies that
Hmm.
would impact them in the community, like vaping, like smoke-free events downtown. That's really powerful. Right. So it's not just us as subject matter experts,
Yeah.
but it's that, again, that community voice
Hmm.
that we're hoping we have regular touch points with, we're in tune with.
And I think that's really important because when we talk about the strategic prevention framework, we always go back to these two core principles, which are cultural competence. And this is what we're talking about here, making sure we're
Hmm.
reflecting the voices of our community and involving them in our prevention work. And then the second piece is that sustainability. And that's where you were talking about bringing these partners together, making sure we have collective effort and impact, and that it lasts for years. It's not just a one time project.
Right.
So that's great. I love that we're already addressing those two core
Yeah.
competencies. And you also have already mentioned, I think, the two core pieces to the capacity step, which are the resources that can be the people required, the partnerships, the skills, the money, right? There's a big financial
Right.
aspect to
Right.
a lot of this nonprofit work that we do.
The readiness, the
And then
leadership, the practical resources.
yeah, exactly. The readiness is the second step,
Hmm.
right? Because we can have all the resources we want, and we can, as partners, say we're ready. We have what we need to do it. But is the community ready?
Hmm.
Because nothing will come across positively or be received if our community doesn't already have the knowledge or the attitude or the mindset that this is a problem and we need to do something about it. And so I guess my next question for you,
Right.
Jess, is have you come across a situation, maybe you have an example, maybe you don't, where in the community there's a problem you've identified, but the community maybe isn't ready. They just aren't aware enough or they don't have enough knowledge about the problem. And how do you address that?
Yes, absolutely. Dozens.
Yeah, exactly.
I mean, that's probably one of the hardest places in our work, right? Is
Hmm.
community readiness sometimes. Um, I would say something that I rely on in terms of a motto sometimes is change happens at the speed of trust, right? Until there's really trust there built with the community you're trying to serve, it's hard to change readiness or like implement change at all. One example of this that comes to mind, again referring back to our tobacco policy work from about 4 years ago, is we were looking at, is there interest, is there political will in kind of moving the needle along in terms of smoke-free
Hmm.
environments in our community. We know we really care about our kids, right? We're a community that loves our kids. We want to do as much as we can to prevent them from, so they can lead addiction-free lives ultimately, right?
Yeah.
That's the goal, leading addiction-free lives. So we started with a couple of just simple steps. One is there enough awareness on this topic in the community about how big of a problem is with our kids and like what age we're starting to see our youth use substances earlier and earlier?
Hmm.
And like, who needs to hear about this? I think one of the very first things we did was we went to city council and we said, hey, we're the tobacco policy committee. Here's what we're seeing locally. is there interest in looking at any sort of policy change around this,
Yeah.
especially when we look at smoke-free distances in front of businesses, or even just having a smoke-free downtown. So when families are coming down to a Blocktoberfest or a street fair or whatever the big events are, that you can take your kids to a safe environment where they're not being exposed to secondhand smoke. And I think what we heard at that time, that very first presentation, was not yet.
Yeah.
Mhm.
Like that's a pretty big leap for us.
Mhm.
Mhm.
And so we took a step back, right? Like, this is often what we have to do with community change work, is like, okay, then what are we ready for? So we actually started talking to downtown business owners. And I think city council had concern, like, what would the business owners think of this? Are they on board? Like, we
Right.
don't want a bunch of pushback. Like, what are they ready for? And we found overwhelmingly as many downtown business owners, even bar owners, were supportive.
Mhm.
I mean, they had some great ideas and solutions about like where to find some middle ground and
Mhm.
make it work for them too, to modify our policy proposal a little bit differently. We talked to parents that were bringing their kids downtown and like surveyed them what they would like to see. Like a lot of wonderful feedback, like in support of this. And we talked to kids.
Mhm.
We had them draw pictures of like what you know, being tobacco free as a community meant to them. Ultimately, the message that we came back to city council with was listen to your community. We actually had the youth go and speak. Of course, there were a couple doctors too that like shared kind of anecdotally why this matters. But honestly, I think it was the youth really speaking to city council about why they wanted to see a smoke free downtown, or at least smoke free events.
Yeah.
That was
Mhm.
super compelling. So I think what it shows there is sometimes you have to take 2 or 3 steps back,
Mhm.
to kind of build that readiness up and come at it with a message that, really resonates with what people might be ready to hear, or at
Mhm.
least take the first step on. Ultimately, I'd love for us to get to a smoke free downtown, or,
Yeah.
other policies that continue to progress us closer and closer to that standard, but you have to move at the speed of trust.
Part of that I found the most interesting was you had community buy-in, you had community readiness, but then you run into barriers with leadership. Part of that capacity building, like we have to
Right.
build that trust with leadership. The community wants this, we
Yep.
want this,
Yep.
but it's not happening.
I think it goes back to the importance of really doing a strong step one with your assessment,
Hmm.
because that assessment data can really tell a story. And it goes again back to not only just the numbers, the hard quantitative data, but the qualitative too. Because
Right.
as you mentioned, it was the stories, it was the anecdotal evidence
Mhm.
from the youth, from the
Yeah.
Business
businesses
owners.
downtown that said, yeah, this is important to us. We do think that we want this change in our downtown area, and it's important for the health of our future, of the community
Mhm.
members.
Yeah, what are some of those ways that you actually assess community readiness? How do you look at things around you and go, is the community ready for this? Like in that example, what were some things that you did?
We love a good survey. We love the informant interviews,
Yeah.
of course, like all the things, right, that you would
Mhm.
expect. But honestly, I think it goes back to those conversations that
Yep.
really give us the best barometer of where people at. Because then you can kind of dig into like, what are the barriers? What are their perceptions of the
Mhm.
issue? And what are maybe some small wins that we could get to first? That's sometimes a luxury, is having time to sit down and have those conversations. But I feel like the return on investment is so large. It really matters. And then it goes back to that feeling of, as a community member, in those conversations, you feel like you're co-creating the solution with the person
Exactly.
asking the question,
Yeah.
right? And it
Exactly.
kind of breeds like this inherent feedback loop, because you want to get back to them, like what came out of that
Mhm.
discussion, what is going to come next, how can they get involved, right? I think it's very relational. So as much as we can do that in our work, I think it pays off. Yeah.
I really love this example because as we go through this strategic prevention framework, we kind of talk about it in a stepwise pattern, but it's really not. We also talk about how these are all
Right.
intersecting
Hmm.
steps, and we're already seeing we're just on step two, right? And we're trying to get a buy-in from leadership. And they're asking us questions, and we got to find more information for them. So it's almost like, okay, we're already going back to step one.
Yeah.
We're doing our own assessments to collect more data to bring back to leadership to say, hey, this
Right.
is what we found. And is this more convincing, right? Does this help change your mind about this issue. All of these steps, even though they're kind of broken down, they really are intermixing all the time. And we're having to go, you know, 2 steps forward, 1 step back, even though we might be in, you know,
Right.
capacity step.
Right.
Yeah.
I think back to what Vanessa said on the previous podcast. It's not linear,
Mhm.
right?
Exactly.
If anything, it's kind
exactly.
of circles over and over again. And
Yep.
I think that's smart because did we get it right?
Yep.
Yeah.
Or like, what would you recommend would be like a more easy to digest solution,
Yeah.
right? That you could be on
Exactly.
board with. Because if we don't have the community with us, then what's the point,
You're right.
right? And we're not going to win everybody over, of course, right?
Yep.
Yeah.
But when we're getting closer and closer to what the majority feels is
And
the better fit.
And there's another perspective to all of this too, which things change over time. Things evolve.
Right.
And specifically with tobacco or nicotine addiction, it's like we started with cigarettes and then we transitioned to vapes. And
Yeah.
all the same work that they did with cigarettes, we're doing all the same things again with vapes. And now we have nicotine pouches and it's
Yep.
all the same work again with nicotine pouches. And it just feels like we're kind of like stuck in these loops, you know, very similar substances, a lot of
Yep.
similar properties, but you know, it's a framework. Got to keep going back and forth until what is the end goal? I don't know. What do we do?
Till we solve all the problems. There's nothing else.
Yeah.
Exactly. I mean, it's so true though that the problem's always changing, and I think that's another thing to consider when you're bringing your partners together. And it's like, okay, so why are these partners at this table? Do we all care about if the problem changes to alcohol now instead of tobacco? Are these partners going to continue to stay at our table? Because that's a big piece to the
Right.
sustainability of our work.
Yeah.
Sorry, I don't know what's more. It's not on the question here, but I'm so curious now. Like, how do you find the small wins in things? Because it seems like we repeat ourselves so much in this work, and it can get really heartbreaking. Like a lot of the times, like, oh, I just did that 3 years ago, and now I have to do this whole thing again. So how do you find that? I don't know, that sense to continue on, to keep. Where does that drive come from to keep doing this work?
The small wins that are really exciting to me are the ones where they're so organic. They're grassroots. They're coming from community members bringing an idea up to us sometimes. It's
Mhm.
like something that they see directly in their neighborhood or at a school where their kid goes to school, right? Goes to class. Like it's coming organically from the community that cares. Because it helps break me outside of my in the box thinking sometimes, right? And I love when a community gets excited about, wow, I have agency for change here.
Mhm.
Like there's something within my locus or my community that I can actually do something about. And that's the beauty of living in a rural community like Douglas County
Yeah.
is I feel like there is more opportunity to do something about it.
Mhm.
With this issue of, smoke-free environments, like our small win was the city council approving a smoke-free event policy. So
Yeah.
at least those large events where we're bringing everyone downtown, we know it's a safe smoke-free environment, right? And just building upon that over time is like, how do we continue to come back and have further conversations about what's next, how this problem continues to evolve in our community,
Yeah.
what we're seeing at the ground level with our youth. And just staying in communication and conversation with those elected leaders, I think, is really key. And then elevating and bringing with that the voices of those that you're hearing from, right? That we are in touch with daily, those
Yeah.
families. And I think that goes back to the cultural competence piece, right? Is like,
Absolutely.
sometimes we're in a place of privilege because we have access. We
Yep.
have access to get a meeting with the city manager or to go in front of city council and feel okay asking for that.
Yeah.
But how do we bring and elevate other voices that maybe don't feel like they have that same access?
Yes.
Mhm.
Not doing that on behalf of them, but really they are the ones coming into the room to really speak
Yeah.
to that issue and how it impacts the communities where they live. So I think we take that really seriously is like, how can we continue to build capacity and empower other leaders from those communities
Mhm.
that our leaders really need to hear from, directly from.
Yeah. I was working in a pediatric clinic with Dr. Dannenhofer. And as a young, pre-med student, I was like, I want to go to the big city and I want to make big changes and all the things. And so Dr. Dannenhofer kind of sat me down and he sort of said something along the lines of like, you have the opportunity to make big impact in small communities.
Yes.
But as soon as you get to the big city, your impact is really watered down.
Right.
Small fish in a big pond versus big fish in a small pond type of thing. The difficult thing about prevention, we talk about this all the time. You don't see when someone doesn't start smoking. You don't see when someone doesn't develop an addiction.
Right.
you do see when you help someone out of an addiction, that's very rewarding too, but that is not prevention, that's treatment.
Mhm.
Mhm.
And so, yeah, finding these wins, what does that even look like? And talking about, yeah, your community is providing feedback that they like these healthy initiatives. They're engaged in what you're putting forward and promoting. And I think that can kind of, like you're saying, continue the work and continue to inspire. Of course, there's got to be some personal, interests always that you care about health and well-being and helping others. But there's oftentimes a lot of people who think that way
Mm.
coming together that continue to boost each other up, even when you're kind of feeling like you're in the trenches of this hard
Mhm.
work.
Mhm.
And
Mhm.
I think that's so important. It goes back to the need for those partnerships,
Right.
to make sure that we can keep that kind of positive mindset and attitude and
Right.
forward thinking.
Yeah.
Yeah, I think burnout is real
It is
in this
definitely
field,
real.
Yeah.
right?
Yes.
Yeah, because
Yeah.
we are in the trenches day to day. So, yeah, how can we continue to lift each other up as
Mhm.
partners in this work when
Yeah.
it gets hard? Yeah.
And what people probably don't know is we work together all of the time.
Yeah.
I mean, we all sit on the tobacco policy committee. Our work intersects so often that, especially in a small community, I don't know what it's like in big communities, but it's so great to have partners that you can rely on. Like we don't work at the same organization, we do different things, different tasks, but we intersect all the time and work together all the
Yep.
time, and that's a lot of fun because you're all my colleagues. We work together,
Yep.
even though we're different in many ways. And
Yeah. And back to, other elements of capacity, I think our community really does a great job of looking at, yeah, these are some resources we need to go after, right? We need more funding in this area. How can we like sync up on a joint application
Yes.
and find, one person in lead, others supporting it?
Mhm.
But I think we share that credit generously for
Mhm.
the most part, right? And we celebrate those big wins together. But we're always looking, I think, for the greater good of like, how can we bring more resource capacity to this county and do that collectively
Mhm.
Yeah,
versus us
that's
each kind
great.
of carving out our own slice.
I
Yeah.
Yeah.
think that's also a really good example of like a way we can build strong relationships, trying to de-silo work,
Mhm.
have shared impact, shared ownership, including over financial grant
Mhm.
money,
Yeah.
right? Oftentimes that can be where people separate because we're
Right.
often trying to make sure that our own stuff stays afloat
Right.
financially.
Right.
Or competing for like competitive grants, like
Competing for
in the
Yes.
same
funds,
community.
exactly. But
Mhm.
what, the community learns is that when we come together, we get more funding that's
Right.
shared across everybody, and we're all working towards the same things. And so,
What's that
um,
saying? Stronger together.
yeah, exactly.
Yeah.
So on that note, though, what are some other ways that we and you and your work build strong partnerships? Because we know, like we've been saying, that's really key. One of these ways you just shared about the grant sharing.
Mhm.
But what else? How do we get partners to buy in and keep our relationship strong?
I think one great example of this was the Catch My Breath program. So, our tobacco policy committee a few years ago, obviously, we're looking at the rates of youth vaping in the community. We're concerned about it. What are we going to do about this collectively as a community? We decided to do some research, start vetting other programs that were out there. What's successful? What's already being done in other communities that we can bring back here? We found Catch My Breath,
Mm-hmm.
which was really impressive, the results it was getting in other parts of the country. And we looked at, okay, what is it going to take to stand this up here in terms of trained facilitators, the curriculum that we use, how we get into schools? I think it could have been really easy to be like, okay, adapt, you got this, go.
Yeah.
Yeah.
Like, this is an area of expertise for you. But I think we recognized as a group, it's going to take more than just one entity, right? We're going to have to
Mhm.
Yes.
pool some resources here in terms of staff capacity. And that's kind of the beauty of it too, is because we actually pulled in Thrive Umpqua, we pulled in Healthy Kids Outreach Program, and we built this cross-agency team of facilitators. We're like, the goal here is, the shared vision here is we want to reach as many schools as possible. We can't do that with just one entity
Nope.
and
Mhm.
two staff, right?
Yep.
It's going to take a team that's on the same page, playing by the same book
Yeah.
to reach as many kids as possible. And that's like our shining North Star here. So I think just building that team of like, we're on the same page. Like, this is the program we're going to use really allowed us to accelerate our efforts and get to more schools than we would have done with any one of us alone.
Yeah.
I think that's incredibly
Yeah.
impressive too. I mean, y- from an outsider looking in, if you're a kid at the school getting this class, you're like, okay, this person came in and taught this great class or this Catch My Breath program. But the amount of effort it takes to research the program, to pull together these different organizations. It's not the same organizations, 3 different communities and different organizations coming together, working together, logistifying, I don't know, doing the logistics
Yeah, I love
to
that.
actually get out there and, coordinate. Like, that's a tremendous amount of effort that I don't think people really realize.
Yeah, and I think it goes back to knowing who's in your community that has shared goals,
Right.
right?
Yeah.
Like we were able to identify that Adapt and Thrive both have a goal of reducing tobacco use in the community. We also knew that the Healthy Kids Outreach Program has nurses that are in the schools that are
Right.
also trying to promote healthy behaviors. And when we talk to them about it, they're like, yes, let's also help, towards this issue. And so knowing who's in your community is one thing, but being able to portray the issue and explain what you're wanting to do about it and how it fits with their goals too is really important with that buy-in piece and building that strong relationship. And then, with continuing trust, I think is another piece too, is how do we make sure that there's continued trust between our partnerships, and what does that look like on the back end? It's not just going into the school and having the presentation and what they see, but it's regular meetings, constant communication, updating each other on what's going on for them compared to a different classroom, and how can we work together and make sure that we're all feeling good continuously about this project. And so I love this project that we're doing. Shout out also to HCOP because they're not here right now, but it's been fantastic, and we've seen great results doing the evaluation piece with that program. We'll get into evaluation later in another step of our strategic prevention framework, but we're seeing great outcomes from that program. It's very exciting.
It's incredible because you started at a place where we have this need. And then it would have been so easy to be like, oh, well, we don't have the funding. Like, our organization can't do it. Sorry. But you're like, no, we're going to do this thing, and we're going to build the capacity. We're going to make it happen. And you have. And you've expanded the number of schools, right? It's not decreased. It's not the same. It's gone up.
Yeah.
And
Absolutely.
nearly 2,000 middle school students now and 5th graders, I think, that have been reached by the program over the last 3-4 years.
Yes.
Since it kicked off. Yeah, it's incredible.
It really, I don't think we
Yes, can we
should take
celebrate
a pause.
that for a minute? Ring a bell. Cowbell.
So if you're a school watching this right now, reach out to us, because we'd love to have the Catch My Breath program reach as many students as we can. Because we know that, again, going back to knowledge, education, awareness, allowing students to choose what's best for them. They can't do that if they don't know what they're doing to themselves. That's really the goal of that program, and we want to get it out to Douglas County as far and as wide as we can. Okay, well, Jess, thank you so much. This has been really a great conversation about capacity building the resources and the readiness, a key part of that, to doing our prevention work. Join us for our next episode, where we're going to break down step 3, which is all about
planning.
Yeah, we got it.
We got it.
We're going to be diving into how we actually address these problems that we've identified.
Yeah.
And
we're going to do a little breakdown too, right?
We are. We're going to talk about how we build logic models to actually address these problems.
And work you all through it as well.
Yeah. So tune in.
We'll see you next month.
Bye, everybody.
Bye.